Searching clients in Panorama. Within all client-centric clinical systems, it is extremely important that an authorized user can positively identify a client within the system and work within that one client file to support a consistent health record. Having complete and accurate client records is essential to, among other things, facilitating communication between healthcare team members, to support clinical decision-making, and to provide evidence of care and service provided for both medical and legal purposes. The clinical risk associated with a client having one or more records in the system includes challenges with supporting clinical decision-making and delivering service. There are two basic principles that support the notion of client identity management. Number one, every client should have only one clinical record, which constitutes a longitudinal record of care. And number two, there needs to be a minimum mandatory amount of data required for a client record to be set up in Panorama. Panorama will accept two types of clients into the system, determinant and indeterminate. Most clients in Panorama will be entered as determinant clients which have a minimum data set associated to their file. A determinant client is a client who is comfortable fully disclosing their true personal identifiers. A determinant file will include client's legal first and last name, date of birth, legal gender, and care card number and/or address or telephone. Indeterminate clients are those clients who do not intend to have their true identity recorded on their client record, or clients who are identified as part of an investigation when there are insufficient client identifiers to create a determinate record and where public health intends to record services. There are three different indeterminate client types: pseudonym clients or contacts, anonymous HIV testing and reporting, used only by the anonymous pilot group, and get checked online testing and reporting. These options were created to address a small cohort of clients that see identifying their true personal identity as a barrier to testing or treatment. For determinant clients, best practice is to enter the following mandatory data for each client: last name, first name, date of birth, and legal gender. These first four are mandatory fields that need to be filled out in order to create a client in Panorama. A personal health number and/or address are also required, though not system mandatory, as a minimum data set for proper client identity management. Performing a client search. There are a few ways to search for your clients in the next-gen version of Panorama. Most searches will start with the screen you see in front of you. To start your client search, navigate to any module along the top of the dashboard. From the left-hand navigation, select Search Clients. This will open up a basic search criteria screen. When performing a basic client search, it is best to search out a client by using his or her first name, last name, date of birth, and/or gender first. You may use the percentage sign as a wildcard if you are not sure of the spelling. It is a good idea to search for hyphenated names, for example, Smith-Jones, as Smith %, to ensure a thorough search is performed. This ensures that a broad range of clients will be searched for, minimizing the potential for duplicate clients to not be seen. Searching with the inactive checkbox defaulted as checked will allow all records in the system to be searched out, just in case a file was marked inactive. Including phonetic matches will also assist if the exact spelling of a client name is not known. For example, Stephen with a PH and Stephen with a V. The Retrieve button will fill in all of the fields previously entered within the same Panorama session. The Reset button will delete all filled-in fields. If your search is complete, select the Search button. If more than 150 results are found, the system will not show a client list. Rather, it will show a message that too many results were found and the search should be narrowed. At this point, adding more to the search to include PHNs, addresses, alternate IDs, school information, or demographic information will help narrow down your search. To search with the personal health number, client ID, or additional ID, enter the client number and then select the client number type from the drop-down menu below. To perform a more thorough search, you can enter in school information into the Basic Search section, or expand the Advanced Search section towards the bottom of the Basic Search. Always perform an exhaustive search to ensure that the client does not already exist in the Panorama system prior to a new client record being created. Once all search criteria is entered and the search button is selected, the search results will display at the bottom of the screen. To set the client into context, select the checkbox of the client you wish to work with. Click Set in Context to put the client into context. The screen refreshes and a confirmation message will display on the right-hand top of the screen. Once a function has been selected from the left-hand navigation, the chosen client will display in the header confirming that all your actions to follow will be associated with that client. If you would just like to preview the record rather than enter it, you may click on the Preview button and a Client Preview modal window will open on top of the search results, displaying the client's demographic information. In addition, dependent on which module you performed your search in, a Client IMS Profile button, Family Health Summary button, or View Subject Summary button will also display. These buttons will also put your client into context and bring you directly into the respective screens. Selecting the Update button will set the client into context and bring you into the Client Demographics screen to update the client demographic record. If the client you are searching for does not appear, a new client can be created by those with appropriate permissions, generally administrative staff. The Client Quick Entry and Create Client buttons will navigate to the corresponding client creation screens. Another way to search for clients when a client is already in context is through the People icon in the client header on applicable Next-Gen screens. Clicking this button will bring the user to a Type Ahead search field where the user can type ahead a client name, client ID, or client PHN to search for a client in the database. If found, the user can select the client that is returned and click the Update button that will become highlighted. Recent work. In addition to the client search function, you can also use recent work from the left-hand navigation to find client records you have been working with recently. You may be interacting with the same client, cohort, or outbreak over a period of time and wish to access their record quickly. Use the Recent Work link at the top of the left-hand navigation to quickly access your most recent work items and put your client, mass event, or outbreak into context without having to search for them. Once clicked, Recent Work expands to show a list of the 10 most recent clients, mass events, or outbreaks you have set in context or worked with. This list is tied to your user account and will remain current between logins. The client, mass event, or outbreak context you are working currently with will display at the top of the listing. To use Recent Work, click on the client name hyperlink you want to bring into context. This will bring you to the last module for the client you have selected and put your client into context. You can then start working with that client. Clicking on a work item hyperlink below a client name will put that client into context and navigate you to the associated screen. Remember, it is important that you do not use recent work in front of clients for clinical care, as it can show diseases associated to previous clients you may have worked with. To find Panorama-related support documents, such as Quick Steps, Data Entry Standards, or Communications, click on Technology and Computers from the InsideNet main page. From there, select Public Health Systems. All of the Public Health Systems documents are listed on this page. Users can use the Search Documents section to search by keyword, application, module, or section. If unsure, searching by keyword will yield the most likely results. Alternatively, users can use the filters available in the top row of the document list to narrow down items. Each module within Panorama will have its own separate set of documents with corresponding quick steps, guides, data entry standards, flowcharts, etc. After consultation with your team lead or supervisor, if you are still in need of Panorama support, please do not hesitate to email the Panorama support team at ppsystemsupport@interiorhealth.ca. Congratulations! You have completed the Panorama Searching for Clients course.